It'd be around half of that.
So if there's let's just say 20 million. Let's just call it an even 20.
Yeah.
So if there's 20 million and 3/4 of that, so what is that? 15 million?
Yeah.
Essentially. So 15 million men in Canada
will have HPV.
Will have HPV at one point in their life.
Yeah.
Wow. Okay, so welcome everybody to another episode of the Gents Talk podcast. We have with us a special guest, Dr. Jia Hu. This is a particular episode that's going to be centered around men's health and better understanding as men what we should be doing in terms of preventative care and how to deal with certain diseases and how to just be healthier in general. But this particular series or episode rather is brought to us by Merck, who is very intent on making sure that men become more aware of these kinds of conversations. So Dr. Hu, welcome to the Gents Talk Pod.
Thank you for having me.
Welcome.
Oh, really excited. You have such an incredible bio of like accomplishments, but for the people who don't know you, sort of briefly, who are you? What do you do? And then why is HPV such an important topic?
Yeah, I mean, I think when people say that, it just means I've been in school for too long. So I'm a public health doctor and also a family doctor. And so, I mean, I was one of the medical officers of health during COVID, so did a lot of that stuff. But vaccines are very, dear and near to my heart. And right now, I run a not-for-profit called 19 to 0, which is really focused on promoting important health behaviors like vaccination, like cancer screening. These are all things we'll cover today, actually. And then I have a few sort of other jobs. But I mean, I think that the thing we'll be talking about today, which is around HPV and vaccination, is really important because, I mean, fundamentally, we're trying to get people to take steps to prevent cancer, right? And, sometimes it's easy, sometimes it's hard, but, anything that can prevent cancer through a vaccine, I think is actually pretty straightforward.
So let's start with the most basic element here. What is HPV?
Yeah, so HPV is Human Papillomavirus. It's a virus, generally a sexually transmitted virus, or can be transmitted through any sort of contact that is known to cause things like warts, genital warts, and also different types of cancer. So I think most people know it to cause cervical cancer in women, but it's a leading cause of cancers in men, particularly head and neck cancer, as well as anal and penile cancer. And so there are many, many different strains of HPV. There's almost like 100 or more than 100 strains. Some of them cause warts, some of them cause cancer, some of them more likely to cause cancer, but it's a sort of constellation of diseases. It's also the most common sexually transmitted infection. We estimate that about 3 in 4 Canadians will get it at some point in their lifetime. And so, I think there's often a bit of stigma, quite a lot of stigma on talking about sexually transmitted infections. And, it's really important. I think we talk about these as well as other issues pertaining to health.
Yeah. And so is it that HPV is just not common among men, like not commonly understood, or men are just not aware of it as much?
Yeah, I mean, I think that it is less, I think most women, about 80% of women sort of know what HPV is. Only about half of men do. I mean, I think people's knowledge of different things is highly variable, right? I think when it comes to something like HPV, I think we, again, think of it as STI primarily. Very few people know that it causes cancer. Very fewer people know that it causes head and neck cancer. And so I think that for sure knowledge is lower in men. Knowledge about the fact that it causes head and neck cancer, mouth throat cancer, very, very low. But I mean, like a lot of things in medicine are like that, right? So I mean, this is why we're having a chat today.
So, go ahead.
Yeah, no, I've only heard about HPV maybe 8-9 years ago. And I just heard, when I heard about it, it was very, this is women. It's for women.
Yeah,
and
yeah.
Like women can catch, men can carry it, but only give it to women or something. Obviously, with these things, it's always, you don't really know the full information unless that's exactly why we're talking to you, right? So has it always been around? Is it something newer or?
No, it's kind of always been around. And for sure, I think that, it's viewed primarily as a sort of a female or women's disease because of the association between HPV and cervical cancer. But actually, when it comes to HPV, men are actually more likely to get it from women than the other way around. And so, it's been around for a long time. It's very common in men. It's just very common in general. And it actually causes a sort of, beyond the genital warts, which I think people sort of may or may not know about that, it just does cause a range of cancers. But yeah, it's been around for more than 9 years. We've had the vaccine, I think it first got approved in Canada in around 2006. They've been working on this for a while, so it's been around for quite a while, this HPV. How's
the vaccine administered?
Just a regular, like if you've had your COVID shots, same thing, like needle in the arm. You need a few doses of it, but it's quite benign, right? Like not really many side effects. 3-dose series, so depending on how old you are. Most people need a 3-dose series, but lifetime protection, more than 95 to not 100% effective. So it's a good. These vaccines generally need once, pretty much, and that offer lifelong protection are the best, right? So it's a bit more straightforward than say COVID or flu.
Well, yeah. Plus, as you mentioned, since 2006, there's a runway of history there.
Quite a lot, yes.
Yeah. So is this something that somebody would consider or men should consider taking before, or is this something that people can they take it before, or something you take after the fact?
Before, after,
before a person contracts HPV.
Yeah, no. I think that you can always get it, actually, right? So because HPV, again, HPV is kind of confusing and complicated. Again, hundreds of strains of it, right? And so what happens for people is that you can get one type of HPV, you can clear it because your immune system can deal with it, and then you can get another strain of HPV. And so the whole idea is that there's no upper age limit. Or, there's no everybody, it's sort of for everybody. And I think in the past, people have thought that, you need to be, get it before you have sex for the first time or get it when you're younger. But really, it is for everybody. Right now, in most Canadian provinces, we give it to people in junior high. Around that age, actually. But because we only started giving it, we started giving it to girls in junior high in 2008. But when we started giving it to boys in junior high, around 2017 in Ontario, it means people, your age, I don't know how old you guys, but assuming our age, would not have gotten it routinely in school.
Well, I'm going to admit, I don't think I'd heard of HPV prior to this conversation. And I think that speaks to your point of I think anyone who may have heard of it would typically think of it as something geared towards women and less so towards men.
Yeah.
And we also just generally struggle as men to go and take care of our health.
Oh, 100%. Yeah, whether it's physical or mental. Yeah, I have no exception to that myself either. So,
is it the 3 doses? How spread out is it?
Oh, it's a good. You get there's sort of over 6 months. 0, 2 months, and 6 months. I should check that. So ask me that again. Time for me to get out my Google machine.
So 0. Okay. So I guess in the interim, it's just about understanding. What that looks like when you contract HPV. So what can a person expect once they have it? How can they tell that they have it? What are some early telltale signs that, hey, you may want to go see a doctor for that?
Sorry, it was 0, 2, and 6 months.
Okay. 0, 2, and 6.
Yeah, a lot of the times you don't have. Okay, so a common symptom, right? If you had a symptom, would be genital warts, but a lot of people don't have any symptoms at all, right? So I'll give you an example, sort of in a woman and in a man as well, right? So the reason in women, what it can do is it can sort of lead to the final state of cervical cancer, but along the way, you often don't have any symptoms. You kind of just have changes to the cells in your cervix, and that's why we do cervical cancer screening. In women, that's a pap smear. In men, in the head and neck cancer, again, a lot of the times you don't really have any symptoms until it's kind of too late, right? By the time you start having symptoms of a cancer, it's really kind of advanced. But in general, the symptoms of head and neck cancer would be things like a mass in your neck, change in your voice, weight loss, those sorts of things. But the whole idea is to, we don't really have a good way to screen for head and neck cancer. And because we don't have a good way to screen for it, it's all the more important to sort of prevent it when you can.
Why don't we have a good way to screen for that?
So there's a lot of sort of cancers we can't, to have a good screening test, you need a sort of test that lets you detect the disease early enough. But the test also has to be, on the one hand, it has to be sort of specific, and so I'm using jargon now. But you basically need a test that can detect something early enough, but it can't be too inaccurate, right? A lot of screening tests are a bit too general, and then if it's saying you're positive every time, it's not going to work very well. So you need something that's specific enough to the disease. It has to be early, and we just don't, we don't have that. That's why that's part of the reason we don't have screening tests for a lot of cancers. We right now screen for breast cancer, cervical cancer, colorectal cancer, and very recently lung cancer, but many other types of cancer like pancreatic cancer, stomach cancer, ovarian cancer. We just don't have the testing available.
On a more general point there, is that like we just don't have the screen, like we don't have the technology available, or it's just not mass?
We don't have the technology.
Okay.
Yeah. Because, when it comes to screening, and maybe I can explain this a bit better, you basically need a test that, like when it comes to any test, and, in medicine, it's not like everything is like perfectly black or white, right? Like it's kind of a spectrum of illness. And sometimes if you don't have a test that can be specific to the disease that's detectable early enough, you won't be able to screen for something. And most cancers we actually don't have, screening tests for. In fact, we only have a screening test for a few cancers.
Wow.
How do you test if you have HPV? Is it like urine test? Is it blood test?
You can do it's kind of like a swab. If you sort of have a lesion, you can, or a wart or something, you can kind of like swab it.
Outbreak, though.
Yeah, exactly. If you don't have sort of visible symptoms, it's very hard to test because it kind of lives sort of inside your cells.
Mm.
And does it get, like if let's say a 20-year-old man contracts HPV, and then the same day a 50-year-old man contracts HPV, is the aggression or the aggressiveness of it vary based on the age of the person who contracts it?
But it's really variable. I think it does depend a lot on sort of the patient's immune status and a lot of other factors. But there's a lot of things we kind of don't understand. Why does somebody get head and neck cancer, and why does somebody else not get head and neck cancer? And so it's pretty variable.
Okay. So what would you recommend as an expert in the space for men to do here?
I think that it's important for men to, have a conversation with a doctor or pharmacist. I'd recommend they get vaccinated, basically, for HPV, but also there's other vaccines people sometimes need depending on how old they are, but really just one to get vaccinated. I think if you have something that protects you against cancer, it's worth getting. And more broadly, when it comes to sort of sexual health, I think people who are sexually active, getting tested sort of regularly and sort of destigmatizing and demystifying the whole thing is good. And, I think your family doctor is going to talk to you for that. I think increasingly talking to your pharmacist about some of these things, particularly around the vaccination piece, can be helpful too if it's hard to, see a family doctor. It's hard to do that. Yeah.
Why do you think it's still a stigma?
It's really interesting, actually. I guess even now societally, it's not something we're comfortable talking about. I had a friend actually, and he is kind of he basically was dating somebody who had herpes, and he totally freaked out. And I'm like, wow, this is a pretty common thing. And, he's like a pretty educated guy who's pretty successful. And, I just think it's, one is we don't talk about it enough. Two, I think are sort of preconceived notions about what these sort of diseases are. And, I think it takes a long time, to shift perceptions around something, right? For example, if I told you, my HIV, right, very treatable, extremely manageable. I don't think most people know that, right? Mm-hmm. And, because of that, people find it hard to sort of talk about some of these things. But I think, different cultural factors can also play in. I came from a Chinese background. It's not something I talk to my parents. Probably not something people talk to their parents about generally, but especially, not my parents. Certain religious factors too.
The cultural thing is hard.
Yeah.
I think that plays a huge role in a lot of ways. I don't think a lot of men are comfortable having those conversations in general, let alone, to your point, with their parents.
Yeah. And I also think that, when it comes to men, very few of us under the age of 40, I think, would have a family doctor. And so there's really no venue sort of to talk about it, right? Like, where do you really go to talk about these things? And so because of sort of a lack of, interaction with people who would normalize these things, it's a lot. I do think it's actually generally a lot better, actually, in the sort of LGBTQ community, right? Like, I think they're a lot more sort of positive, open about sexual health for various reasons. But, I think in the straight community, we're pretty bad sometimes.
And does HPV, is it more prevalent amongst the LGBTQ plus community, or is it more prevalent amongst straight men?
It's pretty similarly prevalent, actually. Okay. So, yeah. But again, very prevalent period, right? With up to, 3/4 of folks having it.
Well, actually, I wanted to get to that. So how many, like, what's the statistic on how many average Canadians, let's say, have it? How many North Americans have it? Like, how much does it affect men globally?
Yeah, I mean, I think in Canada and the U.S., you've got a 3/4 chance of having it in your lifetime at any given time. It's about like a sixth or a fifth of people will have it because, again, you can sort of get it, clear it, then get another type of it. But so long as you have it, you're going to be at risk of either, some of those cancers or some of the, like the warts. So it's not something, like where you just have it and it goes away. Like it's sort of more like measles would be something where the one disease, sort of one type of measles. But this is because there's so many different strains of it, it comes and goes.
What do you mean? Sorry, have it cleared.
Yeah. So, basically, with some illnesses, you can get them more than once, right? Like a cold, right? You can get a cold, you get rid of it, and then the cold can come back again. And HPV is kind of like that, versus other diseases where if you get it once, you're never going to get it again. Like, measles or chicken pox, which, I mean, less common now because of the vaccines or those sorts of things. But with HPV, you can get it and then get rid of it. When I say clear it, it means your body's immune system fights it off.
Naturally?
Naturally,
Okay.
yeah. We don't really have any, we don't really treat HPV infection routinely, and I just wait for the body to sort of clear it, and then you can sort of get it again, or get another strain, get the same strain. It's sort of all possible.
And the vaccine covers all of the 100 strains?
It covers 9 strains, but amongst those 9 strains, you see the most common causing. Of those 9 strains, you do have the ones that cause common the most frequently, and so because. Well, there are many, many, many strains. A few of them account for most cancers, and so. With the sort of 9-strain vaccine, you cover more than 95% of HPV-related cancers.
Do I have to have... I guess you said you can't really tell unless you have like a breakout.
Yeah.
Can you only pass it on if you have a breakout, or you can just not have a breakout and still pass it on?
You can still pass it on. Yeah. You're more likely to pass it on if you do have sort of a breakout, as you say. But there is something called asymptomatic shedding where you can sort of get it even if you don't have any symptoms. When it comes to, and again, this is part of the reason why HPV is so infectious. For some sexually transmitted infections, wearing a condom is going to be enough to prevent sort of transmission, right? For this, because you can pass it on through just skin to skin contact, a condom will help, but it's not going to, eliminate.
Like hand to hand?
More intimate, like prolonged sort of intimate contact. Yeah. Oral sex, vaginal sex, anal sex, those sorts of things.
What about like kissing, like through saliva exchange?
I think through enough of that, you could also pass HPV on, yeah. And that's sort of where you can get sort of the head and neck cancer pieces. Yeah.
Oh. I didn't realize it was such a big deal, like a big thing for men.
Yeah, I don't want like this all sounds super scary and stuff. I think at this point you're like, oh my God, what should I do? But I mean, I think, live your life as you would live your life. But get vaccinated, generally practice safe sex, right? It's, it's one of many things that...
nothing we haven't been told as guys growing up.
Yeah, exactly.
So what advice would you give to younger men who are hesitant? Because, again, of the stigmas of having conversations with doctors and parents and whatnot, like what measures can they take, or what advice would you share with them?
Who are hesitant about any discussion around STIs?
Yeah, because, like they're afraid of having that conversation for fear of being judged or anything like that. Obviously,
or fear of having it. And like a lot of guys, and we've had this conversation before, where sometimes you prefer not to go to the doctor just because if you're not told you're sick, you'll go on believing you're not sick, and you could be. And
totally.
We struggle with that as guys.
Yeah, I mean, I think a few things. I think one thing is that, if you do talk to a healthcare worker, like usually it's like a pretty safe space. I think there's sometimes shame or concern, but most of the healthcare workers, doctors you talk to are really used to having these conversations, right? And so, as a result, I think sometimes there's just a fear of bringing it up to anybody. I think another thing is that these things are more common than people think they are, right? I think that, there is sort of stigma around having, different STIs, but at the end of the day, even amongst your sort of peer group, probably somebody has had something at some point in their lives. And then when it comes to sort of the fear of the disease, and I don't want people to be so scared of it, like you have a vaccine that's like almost 100% effective at sort of preventing any of these things. And so, if you have something that's good, I think it sort of hopefully dispels some of those fears, just like around HIV, right? I think if most people knew that, again, a lot of people are on like treatment, 1 pill a day, like a lot easier to manage than diabetes, I think, for a lot of folks, like it dispels some of that fear and concern. When it comes to most STIs, actually, almost all of them, they're very manageable, right? Like, I'm not saying people should go out and get them, but they're very manageable, like with chlamydia, gonorrhea, it's like 1 pill, 1 shot, this one vaccine, others like, and I think that, sexual health will inherently sort of hard to talk about compared to other bits of health. Like, it's actually an area where medicine and science are pretty good at controlling disease and illness, actually, right? So
why is sexual health still such a taboo subject?
Oh, it has to be like...
Yeah, it's a good question.
Like, it really shouldn't be.
Yeah.
But it is. And it affects so many... Like, I think too many people will end up getting to a point where they acquire a disease, or they acquire as if they're going out to purchase it. They contract a disease of some kind, an STI, and then now they're dealing with the repercussions of it, as opposed to maybe taking the time to learn something up front and taking the preventative care.
I think it's because I feel like people think if you teach them about sex, then we start having sex. But it's like, you're going to have sex regardless.
Yeah.
Right? So things like, I don't want to talk to my 13-year-old child about having sex because I don't want them to start having sex. You don't want to put that thought into their head, but it's like, the thought's going to be there, right? So I think you have to have these conversations, right? I was wondering, is HPV an STI or an STD, and what is the difference, the official difference?
I think we just call things STIs now. Like, I think
like
that,
they're interchangeable?
Yeah, they're interchangeable. I think we stopped. This is before my time, or like before I was in med school, but I think we used to call them like sexually transmitted diseases.
I've always known them as STDs.
And then we like tried to call them infections, I think, to destigmatize it a little bit. I don't really see the big difference between disease and infection. But yeah, they're interchangeable.
Oh, so anything that is STD is still an STI?
Yeah,
okay.
Exactly.
Okay. So what's the, you may have said this already, but I want to go back to it. At what age can a guy go and get the vaccine to prevent HPV?
Yeah, really. So in Ontario, and it broadly similar across the country, starting in 2017, you would have gotten this vaccine in junior high, like in middle school.
Okay, so it's already being administered.
But just like so in 2017, that was like 6 years ago. So people like that would be sort of in their maybe early 20s, late teens, early 20s. And so, I think that, if you didn't happen to be in middle school in 2017, which, I doubt the three of us were.
Speak for yourself, gentlemen.
Very precocious fellow here. It's really for anybody. There's no upper age limit.
Okay.
So I'm 37. I got the vaccine a few years ago. Even before I learned about vaccines, like I didn't know any of this stuff, frankly, too. Right? Yeah. I'm a doctor. It's even just to the point about knowledge and stigma. I even as somebody who's medically trained, you don't necessarily learn a lot about some of these things. So, but yeah, that's the age. Really, any age. I think it's worthwhile checking to see if you've had it before, the vaccine. You can sort of, in Ontario, they have this little yellow card that you can sort of track. But like on average, if you were, in school in Ontario, between, again, junior high between 2017 and now, like it's likely-ish you got it. And if not, then you probably haven't had it. I think it's something that more and more private health plans are covering, which is good because it's not free after the age of 18 in most provinces.
What does it go for?
It's like $300 a dose, 300 dose. So
$600.
Yeah. It is free up to 26 in the sort of LGBTQ community here. It's sort of variable by province to province. Right. But, it's certainly, and this is a broader issue with vaccines, right? Like not every vaccine that's sort of recommended is free. Right. Although I think they probably should be. And so, if you're in your late 20s, mid 20s, there's a good chance you haven't gotten it. So worth checking if you have.
So outside of, obviously cancer is the worst case scenario. Is there something in the middle where it may not necessarily convert into cancer but it still somehow impacts your immune system or other,
erectile dysfunction or anything
like does it?
that.
Yeah, is
No,
there anything?
no, not really. Like I think warts and cancer are the two things it causes. So I
Okay.
mean, I don't think people generally like having warts, but you know, it won't give you erectile dysfunction, and it won't sort of cause, you know, immune problems or anything like that.
Is there a way? And I know I asked this a little earlier, but is there a way to tell if you have HPV with no visible signs?
Not very easily, and it's not something we would normally check either, right? For something that's so common, you know, I think this is again something that's hard to understand, but you know, like we don't often test to see if you have the flu or not. There's a lot of disease we don't test for. We just, you know, like most people who are sexually active have it, and then you know, even if you have it or you don't have it, you should still be vaccinated.
What's the rate of men who, like, if there's a statistic for this, what's the rate of men that could potentially have it right now at any given moment and not even know it?
Like a fifth of people have it, you know, at any given time, but 3/4 of men will have it, and so,
Will have it.
yeah, like at some point in their lifetime. So it's pretty common.
Do we know how many men there are in Canada?
Probably
Like let's just
19
say-
million, I'm guessing, half the
Yeah, like half the
population.
I don't know how many
population.
people
Yeah.
in Canada.
Yeah, I think there's 38 million. I
yeah,
feel
it's
like I
just
looked
under
this up.
40 the last
Yeah.
time I looked.
Yeah,
It'd be around half of that.
So
Just
if there's
less
nine,
than
let's just
half,
say
probably.
20 million. Let's
Yeah,
just call it an
half.
even 20.
yeah,
So if there's 20 million and 3/4 of that, so what is that? 15 million
yeah.
essentially. So 15 million men in Canada
We'll have HPV. At
will
one
have
point.
HPV
Yeah.
at one point in their life.
Yeah.
Wow,
So
that's a huge number.
if I got HPV and and it passed naturally, why would I get the vaccine? Because in my, like, as an alpha male, let's call this, in this scenario, you'd be like, I beat this. I don't need to get, like,
Yeah, a lot
I
of
don't-
guys will just be like, I'm
yeah,
good.
I beat it. I'm good. Like, why do I need to get a vaccine? I already got it and passed it naturally.
Yeah.
What is, why, how would you, I guess, not convince or just suggest someone to get it even at that point?
Yeah, no, interesting. I mean, one, I think you don't know if you've cleared it or not, right? We don't, again, really test for it. And not everybody gets, I mean, every year there's about, 10 years ago, it's higher now, like 1,500 cases of head and neck cancer, right? And so not everybody who gets HPV is going to get this cancer. But I think that, whether you're healthy, whether you're unhealthy, whether, I mean, usually like it takes a certain age to get it. It happens to people in their 40s and 50s a bit later. But, you don't really know if you have it. The consequences of the cancer are pretty bad. When you have a head and neck cancer, like to treat it, they have to sort of cut open your neck and like give you it's pretty brutal, right? And so I think that
Tell
yeah.
us what happens.
yeah, I mean, basically, if you have a tumor in your neck, your throat, to remove the tumor, they're going to open your face. And so I don't know the best way to describe it. Like, do you remember like the Blade movies from the 90s when those vampires like opened their faces?
Oh, yeah.
Yeah, it's kind of like that.
Oh,
a weird
freaky.
analogy. But, they're very brutal surgeries that last, more than a day, sometimes more than 24 hours. And then they'll sort of like remove the tumor, and then they'll take some tissue from your leg to graft it back onto your face so it can heal properly. And I don't think everybody wants that, right?
No.
It's pretty, it's gruesome.
Yeah.
Yeah. I mean, 50% mortality rate, it's pretty bad. And so, I mean, with any vaccine, anything preventative, right? Yeah, it's not guaranteed you're going to sort of get the thing, we're trying to prevent against, right?
Mm-hmm.
But I think we try to take steps to sort of reduce our risk. It's kind of like wearing like a seatbelt, I guess. Yeah.
What are the, I guess, percentage-wise-ish of getting neck or throat cancer from having HPV?
Pretty low. Like, again, like every year, if we're saying that, 15 million Canadians will have it at some point, in any given year, only about 1,500 or so Canadians, there'll only be 1,500 cases of head and neck cancer a year. But I think that, the consequence is just so bad, right? That you don't want that. And, I think there's
naturally.
and there's
the
like a
worst
lot
case
of things we
scenario
do
is
that I think for health that are, I got to eat healthy, I got to exercise. These things take continuous effort, right? Like, and I'm pretty lazy. When it comes to getting vaccinated, it's really easy, right? Like, you could spend quite a lot of effort staying healthy by doing those things, which you should do.
Yeah.
But this is just easier to do. Sorry, these headphones keep falling off. Sorry, my head's
No, it's okay.
misshapen.
Don't worry, the hair still looks good.
Thank you. I'm always worried about that.
So, okay, in terms of preventative care, you reference things like exercising. I know you were talking about it in a different way, but is there anything, because you referenced it's dependent on the immune system.
Mm-hmm.
what can people do to improve their immune system? Because we know, the reason I'm asking this is because there will be a segment of men that'll say, yes, this is the logical step to take, is take preventative care, and if that requires a vaccine, they go and they do it. But there's going to be a larger segment of men who are resistant to these things because they typically, like as we said at the top of this, they don't take their health as seriously as they should.
Yeah.
We've all been there. I've been there.
It's too late.
Yeah. So what other mechanisms could there potentially be to improve the immune system per se?
Yeah, I mean, I think it's a bunch of different things. I mean, these are sort of general approaches to staying healthy, right? One is like sleeping enough. I think there's more and more evidence on how like sleep is really important to one's physical health and one's mental health. Eating a generally balanced diet, so not just like instant noodles all the time. I mean, I probably do too much of that, vegetables and shit, like
the real stuff.
Yeah. Not I mean, like smoking is really bad. Like not smoking if you can.
Yeah.
But I think and those are and again, like having regular exercise, like all these things will promote general health and well-being, and those will prevent different types of will prevent cancers, will prevent heart disease, and so sort of all of those things are going to be good.
If I don't have a family doctor, how do I go about getting a vaccination?
It's pretty easy. Talk to your pharmacist about it, right? So I think more and more.
Any pharmacist?
Most pharmacists, yeah.
See, it's interesting you say that. I've never thought of a pharmacist in any way other than the doctor recommends a prescription. The pharmacist is just the person giving it to you.
Yeah, I mean, certainly, during COVID, most of the vaccines we gave were through pharmacists, and I think they've they do a really good job actually of, providing vaccinations actually, and I think it's sometimes a little bit easier to see your pharmacist than your family doctor, and so they can definitely provide advice and counsel on vaccination. In other provinces actually, like not in Ontario, family doctors don't give most vaccines, and so it's kind of unique in Canada that here the family doctors give most of the vaccines. So. But more and more, I think pharmacists are playing a critical role in sort of the vaccination process. Even just treating minor ailments, that's kind of a new thing. I think you can see your pharmacist for minor things now, but just sometimes easier to see than a family doc. I do think people who are sort of hitting the age of 40, and I feel like when I first learned this, I was like, oh yeah, that's ages away, but I'm pretty close to 40. Maybe you should try to find a family doc, because that's when we start recommending sort of screening for things like cholesterol and diabetes, and it's kind of good to just do an overview of sort of your, health at around that age.
So what, based on sort of your experience with HPV, not saying you've had HPV, but just your experience as an expert in the space, what is it about HPV that we haven't talked about yet that you think we should know?
I think we've covered most of it, actually. I mean, I'll say one last thing, actually. This is kind of more of a fun fact. During COVID, during the pandemic, a lot of things got delayed. In the news, you heard a lot about surgeries getting delayed, actually. Yeah. But more than that, a lot of things like cancer screening, for cervical cancer, all sorts of cancers, lots of people missed that. Vaccination rates plummeted for HPV. So, in the school system, because schools were shut down, vaccination rates plummeted to less than 1%. And so sort of across the spectrum of sort of acute care, surgical care, but also preventative care, the pandemic had a really, really negative effect. And so, I mean, this is just more of a thing for people listening. I think it was, pretty hard to see maybe hard to see your doctor in general, but probably really hard to see your doctor, during 2020, 2021, those lockdowns. But as you sort of come out of that stuff, I think it is important for people to, just check in around their health if they can. But back to sort of the HPV thing. Look, I mean, it causes like a lot of our vaccines prevent against lots of different things, infections usually, but in this case, cancer, really brutal cancer actually, vaccine that's nearly 100% effective for preventing against that brutal head and neck cancer, generally effective for a whole lifetime. I think it's something that's sort of worth getting, and it is broadly available, right? Like most pharmacies across the country will carry it. And it may be, depending on sort of how old you are, still free for you publicly, but you gotta generally,
One of the things I want to ask about, actually, that just came to my mind is the side effects of the vaccine.
Yeah.
You mentioned that there could be some mild side effects. Can you talk to me a little bit about that?
Yeah, let's do like sore arm, low grade, the stuff with better than the stuff with COVID, actually, right? So, it's sore arm, muscle ache, feel sick for a day or two, but that's it.
Okay.
Yeah, it's really safe vaccine. 2006, it's been out for almost 20 years. It's been given all over the world, actually. And so,
how many doses and like is that number available? How many?
I don't know. I'll Google it. Actually,
I'd be curious to know. Like,
Yeah.
because those numbers are usually good signs of like effectiveness type of thing.
Yeah.
Right?
You're a family doctor as well, right?
Pardon?
You're a family doctor
Yeah.
as well.
Yeah.
How often should a man
Are
of
you
our
looking
age-
for a family doctor?
I
Is that
actually,
happening?
I don't know if I'm looking for a family. Look, my family doctor just retired.
Okay.
I got it in an
there's-
email,
there's
and I was
hard
like,
to
oh.
How
that
often
is-
are
that
you
is
in
so
Toronto?
sad.
He's looking for a family
Yeah. Text me anytime. Okay, over 200 million doses says this website at of the HPV vaccine. So that's the only
That's
stat.
a
That's the
lot.
only stat I have. That's a lot. Yep. Okay, we'll use 200 million. Yep.
Can we talk about our physicals and getting physical?
Yeah,
How
of
often should a
course.
man of our age?
How old are you two?
I'm 35.
35.
Oh, okay. We're all like this.
All
I'm
age.
37. All the same age.
There you go.
Yeah, I mean, I think that people should probably start doing this stuff. For sure at 40, between the ages of 35 and 40, if you have any risk factors. Examples of risk factors include, if you smoke, if you drink a lot, if you, some racial groups and South Asians, for example, are at higher risk of heart disease. But really now is kind of the time you want to start thinking about sort of that sort of thing. And when we do a physical at this age, things we'll generally do is we'll have a look to see if you have any diabetes. We'll check your blood pressure. We'll have a look to see if you have any cholesterol issues. Cancer screening for men, the things we can screen for example, colorectal cancer, that starts later, around the time you're 50. But this is kind of, I can't believe we're in our mid-30s now. But this is kind of the age.
Late 30s, 37 to late 30s.
No, that's
We're mid.
yeah. You're right.
We're right on. Listen, we're like
just turned 37 not long ago.
I'm like 6 months away from being late 30s.
Oh.
No,
once
yeah,
once
I
it
think-
crosses over,
I think 36 is still mid-30s.
36
It
is still
is.
mid.
Yeah.
37.
even
37.
37. I think
37 's
38,
late. Okay.
39 is mid 30s.
Yeah.
No, I'm
Or late
definitely
30s.
late 30s. Yeah, but it's around this time actually. So
And why is it so late? Like, why at 50 do you do certain screenings and not earlier?
yeah, I mean, it goes back to sort of this, and I don't think I'm doing a good job of explaining it. But like,
Terrible.
let me
The
try.
worst.
Let me try it again with this test, right? Like when it comes to screening, here's an example, right? Breast cancer screening. Like sometimes you're going to pick up real cancer, but sometimes you're going to pick up not real cancer, like something that's there that you need to like cut out, but isn't really cancer.
Okay.
So none of these things are 100% accurate. So the older you get, the higher the actual rate of cancer. So your test is going to be more accurate the older you get, right? I could screen you, for example, for breast cancer when you're 18 or 20 years old, not you, like a woman, right? But because the incidence of disease is so low at that age, the screening test is going to just pick up a lot of noise, right? And there's harms with overscreening, actually, right? Even though I have to biopsy everything, or in the case of get a colonoscopy. And so, when we start screening depends on the test, depends on like how good the test is, it depends on the incidence of disease as well. And that's why we sort of start that later. There's no perfect test. If there was a perfect test, we could do it whenever we wanted. But
Right.
yeah, these tests are all fraught with, well, I shouldn't say they're so fraught that you don't believe in them, but
But that's why
they're
it's,
imperfect.
additional opinions always, like you hear that a lot.
Yeah, and that's why, there's debate around when to start screening, et cetera, et cetera. But I mean, it's fundamentally driven by a balance between test quality and how common the disease is and whatnot. So, yeah.
How far are we technology-wise to getting to a point where these screenings are more accurate, where we're able to identify these types of cures and so forth?
It depends on the cancer, right? I mean, right now, people are actively working on looking for, when you think of sort of the types of cancers that kill them, lung cancer is the leading killer, actually, right? And, there is a newish lung cancer screening program. It's for people who've sort of smoked a fair amount. People are working on sort of screening tests for other cancers of the pancreas, cancers of the stomach, there's all cancers everywhere. You can get cancer anywhere. But, I would say that there's nothing imminent on the horizon, right? Like we've had breast and cervical and colorectal cancer screening for quite a long time. Lung cancer is probably new in the last 5 years, but I don't see anything new on the horizon. So coming up with these tests is hard, actually. It's difficult.
I'm going to go back to, I'm going to ask you a question that I feel as though maybe we should have started with it. People all over the world know what cancer is,
Yeah.
but they don't really truly grasp how cancer forms, how it begins, how it can affect a person. Can we maybe shed a little bit of light on that element? Because we hear all about it. We hear this person's got this type of cancer. There's the
Yeah.
various stages of it, but not a lot of people, myself included, really fully grasp how it actually works.
Yeah, so at a really simple level, I mean, what cancer is sort of like uncontrolled growth of cells in your body, right? So normally, you have different cells, there's many different types of cells, and they're sort of growing and dying at a sort of normal rate. But if, something stops sort of the mechanism, the control mechanism of sort of how these cells grow, then you could actually get a cancer, right? That's where like tumors start. That's how they can spread. And a lot of things can sort of cause that. What would cause a cell to go haywire from a growth perspective, right? Things that basically change their DNA, right? Their makeup, right? And so, radiation can do that. I think we can all sort of, that three-headed fish in The Simpsons, right? Like, that obvious can cause cancer.
Yeah.
Infectious diseases can as well, actually, right? And this is where, HPV, the virus, interacts with, the cell's own DNA, and it can sort of mess up, the cell's sort of own DNA inhibitory mechanisms. So infectious diseases can cause it as well. And sometimes your cells just kind of like lose, like if they lose certain bits that could tell them to stop growing or tell them to start dying. I mean, that's fundamentally what causes cancer. And then what causes cancer to sort of, really harm a person is, they just grow too big, they migrate to certain areas, they block things, they lead to bleeding. But it's all about sort of uninhibited cell growth.
And it can affect any person at any age.
Yeah, and different cancers are more common at different ages, right? So, testicular cancer, for example, is a cancer that can, it's one of the cancers that can occur when people are relatively young, right? I think like Lance Armstrong had testicular cancer, others like that. Other cancers like prostate cancer, tend to occur when people are older. And so basically there's different, as I'll say, risk factors for cancer. So the older age is a risk factor for almost every cancer. And the older you are, the more likely you are to get a cancer because your cells are just accumulating more mutations, right? And so the more mutations your cells accumulate, the more likely they're, reproductive infrastructure is going to go haywire. There's other risk factors sort of depending on the cancer. Smoking is a risk factor for pretty much every cancer because sort of just the toxins in the smoke like mess up your cell's DNA all over the body. There's genetic risk factors too. Family history, for example, is a risk factor for many, many types of cancers. But that's, just when your cells growing controllably, I guess, would be the...
You mentioned earlier that South Asians are more prone to heart disease.
Yeah.
How come?
I mean, I guess genetically, like I don't know the underlying the biomechanism, but I think they just tend to, on average, get heart disease a bit earlier, more susceptible, higher rates of heart disease, and that's controlling for things like diet and all that stuff, right? Just like, white people, for example, from, the Nordic countries are likely to get multiple sclerosis, actually, right?
Really?
There's certain diseases. Okay. Yeah, that's why we see a lot of it in Canada, actually. It's like very rare. And, celiac disease, very rare in Asia.
What's that one?
That's the one where you're gluten intolerant.
Okay.
And black people, it's more
Also
diabetes?
Heart disease. Yeah, South Asians and, African Americans are likelier to get or a higher risk of heart disease as well, cardiovascular disease.
What about Middle Easterners?
I mean,
anything specific?
It's a good question. Let me.
No, you guys are good.
Am I like you with South Asians? No, I don't think so.
Or South Americans for Poncho, so he can. Figure that out.
No, I mean, I normally think of South Asians and African Americans, but I'm not sure about that.
You gotta look into that for me, Doc.
Yeah. So
amazing. Okay, so ultimately, HPV is something that can be contracted relatively easy. A lot of men are susceptible to getting it. A lot of men will get it in Canada, by the sounds of it, just based on the statistics and the numbers. And, it is something that could potentially pass just through time.
Yeah.
But the vaccine, it's a 3-dose vaccine, can essentially prevent it for life by the sounds of it.
Yeah.
And then doing so will allow you to sort of prevent against that, because HPV at its worst can also cause head and neck cancer. Did you say it can cause any other type of cancer, or was it just head and neck?
Head and neck cancer, anal cancer, penile cancer is probably not the types of cancers people like talking about. Back to the sort of but those, and again, cervical cancer in women. So
is HPV, like when it leads to cancer, is it, how do I word this? So if someone gets throat cancer because of HPV and someone gets penile cancer because of HPV, is the severity different? Like, is it just a more aggressive throat cancer, but it's a more manageable penile cancer, if that makes sense?
No,
Is that
I
even
mean,
a question?
I think it just depends on, I mean, let's use the most common, in women, cervical, and men, head and neck. They can both be quite severe. They can both be more mild. So a lot of it sort of depends on, where you catch it, how good your body is at actually, managing the cancer. But they can both be very severe, leading to death. So,
Yeah.
What is HPV again?
Human papillomavirus.
Human papillomavirus. How do what was I going to say? Yeah, if I have neck cancer, how do I know it's from HPV?
It's hard to, I mean, basically, and again, if you have the main causes really are, like alcohol and tobacco, and, tobacco bad, like chewing tobacco and smoking. Or
Do you mean
HPV.
specifically smoking cigarettes or just smoking?
Smoking.
What about vaping?
That's what I was gonna, yeah.
Probably a lot less. I mean, we don't, like, vaping is pretty new, but most of the harms of smoking comes from the inhalation of sort of like burnt shit,
Yeah.
right? And that's why, when it comes to the global South, one of the leading causes of death is actually indoor air pollution, right? So if you're just standing in front of like a cooking stove all day long, right? That's like burning poorly. You'll also get cancer. But vaping, the long-term effects of vaping, we don't really know about as much, right? Because when did vaping start? Like 10 years ago? I think I had like a vape like 8 years ago. But I mean, vaping is going to be a lot less bad than smoking, I think. And if people need to vape to quit, then I fully support that.
Right.
But yeah, back to, head and neck cancers. One big cause is HPV. Another big cause is, smoking and tobacco. The way you sort of see what causes what in history, have you been smoking a lot? Have you using a lot of tobacco, drinking a lot? And you can also sort of like see if there's HPV living inside of those cells. But, again, not something we routinely would do.
Is it, can it only be transferred sexually? Like, can it be like,
No, like
it's
close intimate
hereditary?
contact.
If I had it
And
and I
you
didn't
have
get
a
it
kid.
traded out a kid, could the kid have it?
Oh, you mean, can you give it to your kid like vertically? Like if,
Sure.
Yeah.
I don't know the
Yeah,
word
yeah.
I'm looking for,
Like
but-
if you had it, no, it's not normally transmitted that way. Like it's not transmitted, for example, from mummy to baby at
Yeah,
birth.
okay, yeah, that's what I
Yeah.
kind of meant.
But
Yeah.
if a mother
You
is
can't be born with it.
breastfeeding-
What I mean, you can't
Yeah,
be born
no,
with it.
generally no.
Okay.
But if a mother is breastfeeding and she has it,
Generally not, right? That's
Okay.
not a, yeah.
interesting. I just learned a ton.
I mean,
I had no idea.
I love learning this shit. I love this.
that's
Yeah.
good. Yeah, you get to learn about lots of different things, I bet.
Yeah,
I
we get to
really do though.
Yeah, we
Really
get
do.
to just figure out what topics we want to learn
Yeah.
about.
At the end of the day, I'm like, man, I learned so much today. Like, some days I'm like, I learned. Like today, I was like, oh yeah, like time's
Yeah.
flying by, and I'm like, oh yeah.
Yeah. So, okay, what final word to you in terms of, tell the audience, tell the guys out there,
Yeah.
tell them what to do.
Yeah, look, I mean, when it comes to this very sort of narrow topic, important but narrow, right? Like, check to see if you've, been vaccinated for HPV. And if you haven't, go get the vaccine. Talk to your pharmacist about it. Talk to your family doctor about it. It's an easy way to prevent some pretty nasty cancers. More broadly, I think that it is important. It's Men's Health Month in June. Is it June? Is it almost June? No, it's almost May. It's
almost May.
Well, we're
May.
filming this in almost May.
This will come
Yeah.
out. Yeah,
This will come out in June.
Yeah, and I think it's just really important. One, not to be scared to talk about your health. Actually, I think, talk to your doctor, talk to somebody, right, about your mental health, your physical health. I think it's really, really important that we sort of, try to take care of ourselves a bit better. And, whatever you're going through, probably a lot of your friends are going through actually, right? And so, that's really important.
So have the conversations with your buddies, with your friends.
Yeah.
How do you check? You said check if you've been vaccinated.
Ask your doctor. I mean, if
If
you have
a
a
family
regular,
doctor. Yeah,
it's kind
that's
of
what I'm
hard.
saying. You have to assume that.
Yeah.
We're not talking about like most people don't have a family doctor.
Yeah,
or
and
at
I
least
don't know how
don't
many
go to
people
it. So
Yeah, or
fuck
ask
the
your
card.
parents
Like,
actually.
yeah, I have that.
Yeah,
I
your
have that
parents
yellow
may have
thing.
that. Yeah. If you're in Alberta, we just have a good record of it.
Yeah.
That's what.
What if you just don't? What if you just
That's
don't
why
know?
you're there.
yeah.
Right? What if you just don't know? Like, you've been by yourself for a long time. You don't
Yeah,
have
is
that
there a way to
information.
test
Yeah,
it?
I
Gone
think
in?
that most people who are older than, I don't know what, junior high plus 6 years will not have gotten it, right?
Okay.
And so in that case, there's no harm in getting the vaccine again.
So you can't get it twice.
Yeah, you can. Like, it's not going to kill you. It's not going to do anything bad to you, in fact, right?
Right.
So,
Make you super strong.
yeah. I won't do that either. It'll just be the reg. But
It's your origin story.
I became a radioactive vaccine or something. But it's Sorry, what was I saying? Yeah, I mean, that yellow card is the best. You know, your parents usually, I don't know, did parents keep track of it here? Like, I didn't grow up in Ontario.
Everybody's different, right?
Yeah,
I still have my yellow card, but like my sister, I don't think has hers.
My mom has mine. And every so often I have to like get the information, and she's like, "Yeah, it's somewhere in the drawer of all your childhood stuff." And
I still have mine. Like my birth certificate's in like pristine condition, so I'm very proud of it. Like,
oh wow, I have no idea where my birth certificate is.
Yeah.
Like, but if I were to guess, you know, we did a little study, and about less than half of people in university have had it. So by the time you're in your 30s, I bet like less than 5% of people, most people will not have had it in their 30s.
Yeah,
right.
It's just, you know, again,
just
not
based on
something-
the numbers of when they started administering.
Yeah, exactly.
Yeah.
You'd have to sort of have sought it out. And again, to your point, you know, most doctors, I think, don't. You know, I don't think most doctors even know that this thing is a leading cause of head and neck cancer in men, right? And so,
Well, that's not encouraging.
so we all got to learn together.
Well, that's why you're going around telling everybody about it. All right. Well, Dr. Hu, I really appreciate you coming through. I appreciate you sharing your insight, your expertise, your knowledge. Appreciate Merck sort of facilitating these conversations, because obviously it's very important for men to be more aware of HPV. And I'll say it again, HPV, because more men need to know about it, more men need to talk about it. Thank you so much for coming through. This was great.
Very much appreciated.
Thank you so much for having me on to talk about HPV.
Yeah, no, it's been awesome. And if you haven't done so already, make sure to subscribe, follow, comment, like exactly like what Dr. Who is actually doing right now.
If you're watching right now, follow the footsteps.
Look, it's Connor McDavid. I know, my boy, my team.
There you go. That's today's article. But just like the incredible Doctor Who is doing right now, please make sure it helps us out, but it also helps get these kinds of conversations out to more men. And really just anybody who wants to learn about these kinds of conversations. It's super important. HPV affects everyone. But also it helps us better understand if you find value in them. So subscribe, follow, like, comment. Even if you don't like something or you have a question or you're critical of something, please let us know. But spare Doctor Who, because this man is a gem, and he is giving us his time. And then you fly out to Ottawa for a conference.
Tonight.
Amazing.
Yes.
Dr. Who, thank you so much for coming through.
Very much
Appreciate it.
Thank you for having me. Again, very fun.
Amazing. Poncho, thank you so much for your time. Thank you, everybody, for listening.
Thank you.